Without further ado, we'll move on to Dwain, who's going to speak to us about the psychological aspects of melanoma. One of the great features of the Yale Melanoma Tumor Board is that we have a whole slew of experts who attend on a weekly basis, multiple presentations, and I think it's fair to say that the Melanoma Tumor Board is unique in having the assistance of Dwain to help us with psychological issues. Dwain.
Good morning, and thank you for inviting me to be here this morning. Is everybody doing okay so far? All right. Thank you for that introduction. As Dr. Narayan said, I'm a clinical psychologist. I'll be sharing the presentation this morning with Sage Vogel, who's a social worker, also within the melanoma team here. Together, we'll talk a little bit about more of the emotional issues, coping with cancer, and the support services that are available for individuals and families who are living with cancer and melanoma. And I'm here today not just as a clinical psychologist who provides care and counseling to patients here at Yale, but also as someone who has two immediate family members who are cancer survivors. So I know both professionally as well as personally what some of you here today and your family members are also living with. And I say that just to start off with the general idea about how prevalent cancer has become, and that while it may feel like you're alone in dealing with this, in many ways, you're not alone. We are not alone. That there are almost 12 million people in this country right now who are living with either a current or past diagnosis of cancer, and over 800,000 are living with melanoma. That 1.5 million new cases of cancer are diagnosed each year, and melanoma will be diagnosed in 13 Americans every hour. And they say that approximately 40% of us will be diagnosed with some form of cancer at some point in our lifetime. So this is a very prevalent condition, which, as we know, is also a very emotional experience. Living with cancer may feel like an emotional roller coaster at times that can affect how you think about yourself, your life, your relationships, and can certainly challenge your ability to cope. And that's why within oncology and cancer centers such as Yale's, what we think about is trying to provide as good of care as possible for the whole person. And this means providing top-notch, exceptional medical care, as well as providing comprehensive psychosocial or emotional support and mental health care for individuals. And this was the topic of the Institute of Medicine's landmark report in 2007, Cancer Care for the Whole Person. And through this report, it highlighted the issue of emotional distress, which is very important because really almost everyone who is diagnosed with cancer, and this includes family members alike, experience some degree of emotional distress as part of living with the illness. And importantly, almost 1/4 to 1/2 of all patients experience significant levels of emotional distress. And this is particularly when the diagnosis is first made or when there's a change in condition, like around a recurrence. And the reason why this is so important is because oftentimes we keep this information to ourselves. We might not share it with our doctor. And so unfortunately what happens is symptoms of emotional distress oftentimes go undiagnosed, unrecognized, and untreated. And one of the things that I think about when thinking about the stress of living with cancer or any significant medical illness is kind of that it's a psychological triathlon of stress in a sense, where on the one hand you have the physical burden of the illness itself. The second factor are the emotional issues that go along with living with uncertainty or the unpredictable course that an illness may have. And the third part of this triathlon, if you will, is the impact, the direct impact on the body and brain that the medications or other treatments might have on the individual that are designed to treat the illness. So really, you've got three important and significant factors that weigh into the overall burden or stress experience associated with living with cancer. Okay, so stress is common. Stress is a part of life, right? How much is too much? Well, we know that stress exists on a continuum, or the idea of emotional distress exists on a continuum. From, on the one hand, manageable stressors that are common, expected, and within our ability to cope. Increasing on the continuum are stressors that become more difficult, more unmanageable, stressors that exceed our ability to cope. And this is where it becomes very important to me as a clinical psychologist, and where I am sometimes asked to be a resource for individuals. When the stress becomes to the degree where an individual is having a harder time coping, where the symptoms become more persistent or pervasive, and where it may lead to the diagnosis of a psychological disorder. And that makes me want to say just a few words about depression, because depression is a very significant and real experience among some people who are living with cancer. It is an illness. It's a medical illness that can be brought up on by both medical illnesses as well as emotional stress. And it's important for us to be thinking about it or recognizing the importance of depression, because depression adds to the overall burden that a person experiences when dealing with a significant illness. It can be associated with other medical illnesses. It can be associated with a poorer course, a more difficult course. It can be associated with other problems, occupational problems, social problems. Whoops. Now, of course, distress is part of life. It's certainly a part of living with a significant illness. But how do you know when you are clinically depressed? Because we all have ups and downs, right? That's also a part of life. Sadness is to be expected. But if you're experiencing a low mood or an irritable mood, or you've lost interest and pleasure in most activities, more days than not, for over at least a 2-week period of time, that's an indicator that you might be clinically depressed. When people have clinical depression, it also impairs their ability to function. You may have a harder time functioning at work, functioning at school. You may have a harder time doing things around the house. And it's usually accompanied by other signs and symptoms as well. We usually think about both physical and cognitive symptoms when we talk about depression. So in addition to the sadness and the loss of pleasure, some of the typical physical symptoms of depression include things like a change of appetite. I just don't feel like eating. I've lost my appetite. Or on the other hand, you're overeating, which is, might be uncharacteristic. A lack of energy, a loss of energy is also very common in people who are experiencing depression. Sleep disturbance is another very common physical symptom of depression. You just can't fall asleep at night, or you're waking up multiple times over the course of the night. Or, on the other hand, you just don't want to get up. You want to stay in bed. You want to sleep all day. Typical cognitive symptoms include things like concentration or memory impairments. You just can't focus. Thoughts of worthlessness, guilt, hopelessness, and certainly thoughts of death or suicide. The good news, though, is that there are many treatments available that help people feel better when you're struggling with depression. Psychotherapy is one of the most potent and helpful approaches for treating depression. Cognitive behavioral therapy has been shown time and time again with many different populations of individuals that it can be very helpful in reducing symptoms of both depression and anxiety, and reasonably quickly and safely as well. When an individual is struggling with what we call severe major depression, where they have many of those symptoms of physical and cognitive symptoms of depression, and it's impairing their level of functioning, oftentimes medication is also a very important and useful ingredient in the treatment plan. And for more mild or moderate forms of depression, support groups can be extremely helpful so that you're in touch with other people, can share your experience and learn from each other. Other approaches like meditation and yoga have also been shown to be helpful in reducing mild to moderate symptoms of depression. And exercise. Exercise is probably one of the best things that we can do for ourselves to help prevent depression, but also to start to feel better if we are depressed. So there are treatments that are available that can be provided by others, by professionals, other psychologists or social workers, but there are lots of things that you can do as well to reduce your risk of both depression or severe distress. And so what I want to do is just focus on a few things that you can do. And when I think about stress, I always define it when I'm talking to people as a state of both physical and mental tension, okay, where tension is really the key word here. And one basic step is remember your ABCs. So this is a little bit different from Dr. Choi's ABCs. Here, A stands for awareness. Sometimes we're not even aware when we're stressed. We might not even know that our muscles are tight. You got that ache in the back of your neck, or your mind is racing, you got all these worried thoughts in your mind. So the first step is awareness. Recognize when you are experiencing those signs and symptoms of stress. B, stop, breathe. Breathe, literally, close your eyes, get in a comfortable position. Breathe to reduce that sense of physical and mental tension. We can't be both tense and relaxed at the same time. So if you can momentarily decrease your level of internal or physical stress, then that brings you to C, which is choices. Choose how you want to go forward. You can go back to that stress thinking if you want, or you can try to change how you think, or you can try to change what you're doing. Within every stressful situation, there are parts of that stressor that are in your control and parts of the thing that's stressful that are out of your control, right? Well, they say that for things that are within your control, problem-solving coping strategies are most helpful. These are things like what you're doing today, getting information, asking for help, working actively on solving the problem. But we can't do that for things that are out of our control. It doesn't help us to try to control something that we can't. That just leads to more frustration. So they say when things, for stressors that are beyond your control or outside of your ability to control, to use more emotion-focused strategies. And emotion-focused strategies are things like faith, acceptance. Find a way to accept or to have a greater sense of peace with the things that you can't control. Change how you think about the problem, and that might help you to change how you feel about the problem. And that's where this basic triangle comes into place. This is called the cognitive behavioral triangle. And I bring it up here to illustrate the important connection that our thoughts have with our feelings and our behavior. How we think directly affects how we feel emotionally. The words that we use in our own mind, that constant dialogue that's going on inside, help shape how we feel emotionally. And if you are aware that some of these thoughts are just plain unhelpful, you are jumping to conclusions, you're assuming the worst, you're worrying, stop, breathe, challenge some of those thoughts. What can you do to maybe replace some of those thoughts with more helpful thoughts that will lead to a better sense of feeling? And maybe sometimes there are things that we can do in our behavior to also help change our thoughts or how we feel. And that's where things like exercise come into play and the importance of healthy habits, which is my step number 2. One of the most effective and simplest ways of reducing stress is to lead a lifestyle that's full of good habits that help minimize your chances of becoming overstressed and helps you to become more resilient to stress. And the first few of these things are like good sleep, eating well, exercising, are probably, things that your mother probably told you when you were a kid. And it's very true. Those are some of the easiest things that we can all do for ourselves to reduce our risk of stress. But also it's important to use your words, be assertive. Don't be intimidated to let your friends or doctors or family members know what you need or how you feel. Don't keep it inside. Make time with friends and families. It's those connections, those relationships that serve such an important buffer. Accept help. Living with cancer is too much for any one person to deal with on their own. It takes friends, it takes families, it takes doctors. Sometimes it takes people like me to also help. But accept help when it's offered, and don't be afraid to ask for help. Counter negative thinking with more realistic or helpful ideas. That gets back to the awareness and choices. Problem solve those things that are in your control, and learn to find a way to accept the things that are out of your control. And finally, one healthy habit that's always good, that helps us to get outside of ourselves a little bit, is to do something for someone else. When we can help someone else with a problem or volunteer, it helps us to feel better as well, and helps to give us a different perspective. My step number 3 would be seeking support. And Sage will say a little bit more about support services as well. But again, social support is the thing that provides a buffer. It helps us to feel less alone and helps us to think differently about our situation. And finally, my last step would be seek professional help when those signs or symptoms of depression become persistent, when you're finding it hard to cope or function, when other people are mentioning that there's a change and that maybe you should get some help. And certainly, if you are ever feeling like you want to give up or having thoughts of suicide, that's certainly a reason to get professional help. So I want to turn it over to Sage to say a little bit more about resources.
Thanks, Dwain. Again, I'm Sage Vogel. I'm the licensed clinical social worker that works with the team. And I want to talk a little bit about identifying resources. We can start with the natural resources that we'll probably find around our home, like our friends and our family, and really to use them to kind of process what we're going through, maybe on a daily basis or just kind of checking in weekly. Also for the concrete needs, rides to treatment. It's sometimes difficult to go in to see the doctor for those monthly or however often appointments, to have someone there with you maybe when you're not feeling so well. There are also a lot of community resources that you might not be aware of. 211 is a resource info line. They are national, and you can call them and tell them what town you live in. They can let you know what financial support there might be. There are also, community centers and religious organizations. There are also state and federal entitlements that would be important for you to know about. Hospital support services. Of course, there's social work and behavioral health service, religious ministries, complementary services, which is Reiki, massage therapy, guided imagery. We also have a palliative care team, a survivorship clinic, lots of services that are very helpful. Support groups. Support groups are great to just be around other people that really get what you're going through. At Yale New Haven Hospital, we have a metastatic melanoma group that has been in existence about 3.5 years. Terrific group of people. The American Cancer Society has a list of all the groups nationally as well. The social workers who run them call in with the time and location. You can always call their number and find out what's going on. Our group is in the evening, but if, for your schedule or just your personal preference, there are groups online. There are also phone support groups that exist. Managing the influx of support. Especially when you're initially diagnosed, you might get a lot of calls, colleagues at work, friends. You don't know quite how to navigate who to tell, what to tell. Something we nicknamed the captain of kindness would be that special friend, maybe an assertive friend or a spouse that can kind of get those people together to either use them in the most efficient way for you, to organize rides maybe, or if you have children, to help pick up your children and bring them to practices, or things like that that really could help relieve stress for you when you're feeling ill or under the weather or getting treatment. There are also websites now, online care managers that can, they set up schedules, all sorts of neat things. PACT, Parenting in a Challenging Time, is a program that we have here, and also it exists at another hospital. Helps parents to talk with their children about their illness. What information to give at what time, how often to check in with them, how to support your child, what resources are there in their school system, in their peer group. How can we check in with them and make sure that they're coping appropriately. Caregivers. Caregivers often want to help and be there for the person going through the illness and sort of put their own needs on the back burner. This is very, very common and similar to some of the signs leading to depression that Dwain talked about, we want to look out for. Feeling overwhelmed and irritable, sleep alterations, weight, losing interest in the things that we used to like to do. Some of the things that we can do to combat that would be to delegate. Those coworkers or friends or family that had been offering to help, what can I do? Let me know, use them. Just maybe a home-cooked meal once a week would decrease the burden on the family that isn't feeling so well or going through a tough time. Stay connected to your own friends and family. We all need to laugh and have a break from thinking about the illness all the time. And there are also caregiver support groups that are really great. And also talk to your employer. A lot of big companies might have, family medical leave of absence, but also the smaller companies, if you talk to your employer and say, listen, I have someone in my family who's sick, I'm gonna need some time. I wanna go to treatment appointments. I want to help them through this. And also for my own mental health, I need a break from work. Often they're more understanding than you might think. And just to take care of yourself, don't neglect your own medical needs. You still need to get your annual physical or, make sure that you're in good health, especially if you have a pre-existing condition of your own. And, staying physically active, sleeping, and eating well. Back to the triathlon, winning the triathlon. So overall, we just, forums like this, staying informed, seeking support, processing your emotions, and finding a healthy outlet through friends and family, faith and spirituality, to have overall good mental health. Thank you.